Hello and welcome to today's episode on Life Saving Aid. Today we are going to be answering a very important question that was asked on one of our videos. The question goes thus: how do you differentiate cardiac arrest and death? How do you differentiate cardiac arrest and death? Now it's important to note that when we're talking about cardiac arrest, put in simple terms, it is a situation whereby the electrical activity that is allowing the heart to work as a pump, when that electrical activity ceases, the heart stops working as a pump. And when this happens, the body shuts down. So, in appearance, when you see someone who is having cardiac arrest and someone who is dead, they look the same. However, you see, for someone who is having cardiac arrest, there are things you can do that can help increase the chances of survival of such victim. As against someone who is dead, is dead. There's nothing you can do about it except if by some form of divine intervention, the person comes back to life. But for someone who is having cardiac arrest, the person still has a fighting chance at survival if those around the victim know how to perform CPR. So in both situations, you see them, they are lifeless, unresponsive. When you try to assess for pulse, they don't have a pulse. When you look at the breathing pattern, for someone who is having cardiac arrest, it's either it's abnormal or they are not even breathing at all. So most times they are both motionless. And you know, the practice in our environment whereby people come across a victim, either he's having cardiac arrest or is unresponsive. Someone who is unresponsive can either be dead or be suffering from cardiac arrest. In such situation, before you declare that that person is dead, don't just lift the hand of the person up and then because it falls down without any response, you try it again, it falls down without any response, you start shouting, man pass man is dead, oh, woman pass woman is dead. No. When you come across someone who is unresponsive, you should know that the person will appear dead. The person will appear as though they are dead. So when you try to move them, they will not respond. You will not see any breathing movement. When you try to assess for pulse, there will be no pulse. So what do you do in such situation? You quickly lie the victim on their back. You call for help. You dial your phone. Call somebody that can help you either move the victim to the hospital or get access to emergency medical services. When you do this, you start cardiopulmonary resuscitation. And now it is even better. You don't have to give breath of life. You are performing CPR. All you need to do is to keep giving your chest compression deep and fast until emergency medical services or help arrive or until you get to the hospital. So to answer your question clearly, there is no difference. They both appear the same. However, if you do nothing, both of them will be dead. Because one is dead, one still have a fighting chance at survival. But if you do nothing because you feel or you assume this person is dead, the person is definitely going to be dead. So please and please, my advice is that if for some unfortunate reason you come across someone who is unresponsive, before you proclaim the person dead, please perform CPR. I hope this helped answer the question. See you in our next video.